we just completed a very successful leadership program. It was wonderful. You did an outstanding job bringing leaders from Germany to the United States and California. What type of leaders attended the program in terms of where did they come from?
Yeah, first I want to say thank you for the great possibility to bring leaders from the long-term healthcare system, from the hospitals, from big hospitals, from small hospitals, CEOs, CNOs, to bring them to California. It's an amazing job from Apex Social to invite the best performers per year, to invite them to the United States for one whole week with great experience. So I think it's great to send the main management to the United States to see, hey, what's happened, what's going on there, how is the hospital. Can you tell me what was your idea to make a great schedule between university, hospital, long-term care?
Yes, well, during the leadership session, we actually had exposed our leaders from Germany to various aspects of the U.S. healthcare system. So we went to an acute care hospital that had a magnet designation, and we could explore what it took to become a magnet hospital, which is a very select group of hospitals in the United States. And I know in Germany there's a lot of interest in creating a magnet designation. We then also explored the educational session and the training with how nurses are trained, the academic rigor around which our healthcare profession focuses on not just doctors but other care professionals, and how some of what we do could also be collaborative with schools back in Germany. And then we had a long-term care, sort of extended care, which spent a day in a facility where we looked at how healthcare and home care is all being integrated into the care of the elderly. So it was a very successful week. You did an outstanding job helping to lead this session, and I think from those discussions we have a plan in place to continue to build on our relationship. So maybe you could talk about that, Sabrina.
I think the relationship is the most benefit from this week. Maybe you remember some of the leaders arrived, they have never been in the United States, they have never speak English, or say they can't speak English very well, and they put every thoughts and scanners all over the board and say, no, I have to come, I have to follow this great invitation, because if the young care professionals can do this for 1 week, for 1 year, for 1 year in a foreign family with a special needs child, so I can do it as a leader too. So I love this mindset that the youngest one go forward and the leader has to follow. I love this mindset.
Yes.
And the relationship is the most important. They arrive and they have the same experience like everyone who's traveling to the United States. They have the jet lags, they feel foreign, and then they get a really great welcome from us. You did an outstanding job too. And Susan, your founder, made a really, really great job. And everyone felt welcome, and we had a great first day. They saw, okay, there's a leader from a bank or from the hospital, and they can present their own company in a foreign country. So it's great, and every day bring them more together. So say, hey, we can talk about everything. We can talk about our scanners, or we can talk about our experience with young employees or with old employees. And I think one of the most important is there is a big difference between the United States and Germany. You can talk about your success.
Yes.
It's amazing to see them grow if and when they talk about their success.
Yes.
They say, hey, it's not the time to talk about I have less of this, or I have more or less of this than you. No, you have to talk about your success, and you see that everyone has same problems, and the talking is not about the issues. The CM is to talk about the ideas and possibilities and creative solutions.
Absolutely.
And I think this is the most important for a relationship between a great organization who gave the families a big benefit and who gave the care professionals a big benefit and gave the leaders a big benefit, because in this time the leaders need some ideas what they're doing with their employees, because we have a hard time of save money.
Right. But they were able to see, I believe, in that 1 week, that transformative 1 week, how transformative spending a whole year could be, and how if they send their care professionals to America for a year, that it's going to transform them. So when they come back, they'll be different. They'll have a different perspective. They will become the leaders of their organization, right?
Yeah.
So that experience for them, the transformative nature of the experience in 1 week, allowed them to see that how transformative coming for a whole year could be, and that this could also be a tool as an organization to say, come and work with me here in Germany, and we will invest in you. And part of that investment includes an opportunity, if you so choose, to go to the United States and be part of a family, be part of integrated into the healthcare system, and then come back, and we will, welcome you back with your job. So I think it helped everyone appreciate the value of the APEX program and what it could do for their employees and for the development of their staff. It was very exciting.
Yeah, and you have met, I think 3 weeks later. This is not regular, but 3 weeks after our leadership conference. I think you met two of them. What was your? What were your thoughts? What have they said?
Right. Well, so we stayed in touch. I have stayed in touch with a number of the leaders, and it's been, through WhatsApp and LinkedIn, and we've been very supportive of one another. And I shook hands at the end of the conference with one of the leaders, and we agreed that I would come to Cologne so that I could experience the German system, and he's built a wonderful system himself, where he has adult daycare and senior living facilities, and facilities for children with special needs, and a whole campus. And so he invited us, so we spent 2 days touring his facility, and also looking at a special needs school, and understanding how care is provided in Germany, and the wonderful work. Right, I think we are all trying to do the same. Right, we're trying to provide the best care for those in need, and the best experiences for our employees. Right, so it was a wonderful 2 days. I think we feel very encouraged. And Sabrina, you've set up this wonderful follow-up where we talk every few months. We have a planning session. And we've agreed that we're going to build on our leadership program, so it's not just a 1 week experience. It's hopefully a lifelong experience, right, where we build relationships that will last a lifetime, and we'll continue to find opportunities to collaborate in a way that will be enriching for both.
Yeah, I think I have heard that one of the leaders from 25 to 25, she organized a really big campaign to say, hey, it's so amazing, because she was there with her teenage daughter. I think this is one different too, that the leaders are invited with their family. I think some of them were with their kids, some with their wife or husband.
It's very welcoming. Very welcoming.
And I have heard that she organized the first month after she was coming back to Germany, some spaces, I think I have heard 20 for young nurses from her hospital. Is it possible for you to save seats or places for care professionals?
Yes, so what we try to do is we find families that have needs, and then we identify care professionals that can meet those needs. And we absolutely, when we were meeting with Jasmine from the University of Aachen, a beautiful hospital system, and we actually toured the pediatric neonatal intensive care unit there. And one of the nurses from that unit will be coming to APEX very soon, so we're very excited that there's this collaboration between the hospital and the nursing program and Apex, and we are. We target families that have needs that we can match with care professionals in Germany that want to come over. So that they are able to invest their time in a way that is enriching to them in their careers, and the family is able to have their needs met. And many of the care professionals that come to the United States, even if they're here for a year or two, they build lifelong relationships with their families. So, and as our leaders said, our care professionals, the Apex care professionals, the 1,000 or so that we replaced, are the future, right, of both Apex and our healthcare system in Germany. Right, they're hard workers. They show up to work. They want to contribute. They want to think creatively and out of the box, and they took that first leap of faith in coming to the United States to do it, and all that did is sort of empower them to go even further. So, we are really excited about what the future may hold, and we, are going to build on the leadership program, the care professional network that is back here in Germany, and continue to find ways to collaborate.
I mean, we have the changing times in Germany with a lot of save money, changing laws, changing situation of hospitals. Some hospitals has to close, some universities, it's not just for the nurses, it's for the therapists and the social work and education too. I have heard a lot of kindergartens has to close too. So I think it's really important to be in this time in 26 modern company and say, hey, it's part of our branding to be open-minded and to be creative. And I think I talk with a lot of leaders in this time, CEOs and CNOs, about we have to save money, we have to save money. I think no, we have to create new opportunities.
Yes.
I can say I have to save money with firing nurses or firing therapists, or I can say, hey, I can't give them a place in this time, but maybe in next or in 2 years, so I will give them a chance to make new education, to be educated, to make new experience. So I think it's really, really, really important and great from you to say, hey, we are open to make collaborations, to give you hospital or you education center or school the chance to be a modern, branded company to send them for 1 or 2 years. Have you heard about the situation? Do you think it's a good idea to be a leader and say to someone, hey, this year I can't give you a place, but maybe next year, but I will give you a contract? Maybe, I think, maybe do you think
I think it's a great idea. I think there's an opportunity as, rather than saying, oh, we are just going to furlough or let go of employees, that there, times change and needs change, and so you also don't want to lose good people, right? So rather than having to let them go, this provides an opportunity to have them come to the United States for a year or maybe 2 if necessary, while you continue to invest in your own system back here, and it protects, I think, your workforce, gives you an opportunity to protect your workforce. At the same time, it allows you to invest in the best people, right? Because every company wants their employment, they want leaders, they want workers who show up on time, and we hear a lot about the young generation. Oh, they take too much sick leave. Oh, they don't want to work. Oh, they're all focused on work-life balance. And yet, those that come over to the United States, they're in a home working 40 or 45 hours a week. It's they're very hard workers, and they sort of break down this misperception that they're not going to be focused on showing up for work, and then. So they validate that, in fact, they're very capable, that they're very talented, and that they are the type of people that an organization back here should want to invest in. And so one of the things we do with our leaders is we provide an opportunity for our leaders to actually have access to care professionals that maybe came out of school that are going to come back here and get, need to find a job, and we provide preferred access to our leadership team to actually interview our candidates as they're looking to fill their staff. Just as I believe for the leaders, they can promote our program as a way to save from just saying we're going to cut back, or to allow them to attract better talent. Because everybody wants to come to an organization where people are creative and think out of the box and invest in the employees. Because your company, your hospital is really only as good as the underlying people.
100%.
Right. So
I think I'm a leader too, and I will be so glad to say my employees, hey, I have opportunities for you. I don't want to fire you. Sorry, I don't want to fire you because I have hired you because you are the best, and I want to give you a lot of opportunities in these critical times. I think it's an amazing chance.
Yes, and I think the World Cup, FIFA World Cup is taking place right now in the United States, and all people from all over the world are coming, having a wonderful time, and it's just showing how we all have differences. We celebrate those differences, but we're so united as a world, right? There's so much that we share, much more that we share than we disagree on. And so I believe it's a really exciting time in the United States. It's an exciting time here in Germany. For the two of us collaborating, I'm really excited about what the future could hold. So,
great.
All right.